If you look at the report on the fund administrator by the infamous CPA Julius Kimboy, there is a missed target, Governor. For example, in Kapsabet County Referral Hospital, you had projected to collect 239 million, but you ended up collecting 155 million. In Nandi Hills, the target was 40 million, you collected at 1 million. That's a slight difference of 9 million. In Meteitei Sub-County Hospital, your target was 13.2 million, but you ended up collecting 5.4 million. In Kaptuma Sub-County Hospital, you targeted 18.8 million, but you collected 7.14 million. In Mosoria Sub-County Hospital, your target was 7.9, you ended up collecting 5.1. Kabiet Sub-County Hospital, your target was 12.1, but you ended up collecting 4.3. In Cherargei Sub-County Hospital, your target was 5.9 million, but you ended up a paltry 2.9 million. According to the auditor report, this was a mid-target of non-collection of 41%. I have seen the results that has been advanced by you, because by the fact that you are the one submitting this report, you allude to two results. And that is where my questions will come from. That they were health workers strike, and hence there was no revenue. So you need to justify before this committee how many times did the nurses, and I remember when there was supposed to be industrial action, you are on record on several occasions that you have averted by negotiating with the unions. Then why does it become a reason? Number two, you say there was delay in supply and delivery of medical commodities, especially drugs, to hospitals. But on record, you have always insisted that there is enough drugs in a hospital. So why are you advancing a contradicting statements, yet you are doing under collection? And now you yourself, you have said on record, if the facility does not collect as per the FIF Act, it might not end up to be sustainable. That is my question one. Question number two, in Cherargei, and let me pick Kapsabet and Cherargei, Kapsabet, the newborn mother unit is yet to be complete up to now. So what is the implication of collection of this target that you are projecting? And number two, in Cherargei, the project that you are doing is not yet complete or installed. Does it affect the projection of your revenue? That will be my question number two, Chair. Number three, I thought you have said, because I've seen your own source revenue reports, that the collection of revenue has been automated. Is it true that in facilities that I've mentioned from Kapsabet, Nandi, Meteitei, Kaptuma, Mosoria, Kabiet, Cherargei, do they have an automated system of collection of revenue? That will be my number three. And I hope, Governor, you are noting so that it is easy for you to answer. Let me finish with this, Chair. And I want to look at their documents which they are provided. Chair, this will be my final question, Governor, on the use of goods and services. I find it interesting in your expenses, which are necessary. For example, in use and goods, that is note number 7 in your financial statements. And I hope your staff are kind enough to show you that is page 19, note number 7 on your financial statements. You did general expenses of 2.1 million. You went ahead and did printing and stationery of 4.5 million. General office expenses, you were 2.1. I hope Chair members are noting this. And then you go ahead and do printing and stationery at 4.5 million. Then you go ahead and do computer accessories at 1.2 million. So when you talk about general office expenses, what do you mean? Because for me, and then interesting expenses, Governor, that you have done, you have catering of 3.4 million. So I assume people take chai and mandazi. With noting that in your financial statement, which belongs to the patients in food and ratios is 4.6 million. But in catering services, Chair, you are spending 3.4 million, which doesn't add up. So you will give us a justifiable reasoning. Governor, another expenses which I find it unfortunate is the health celebrations. I don't know whether you are celebrating that people in Nandi are health, or what do you mean? And you spend 2.1 million on health celebrations. And then, Chair, that's why I will need convincing, because Governor, I have heard you talking about share, the delay in remittances, the sustainability of our hospitals. Chair, and I have noted another thing, Chair, and I hope members will bear with me. Subscription, no, sorry, that is okay. You are spending almost a quarter of water expenses, 800,000. You are spending on airtime, telephone, and communication expenses of 480,000. But water, you are spending it at 800,000. Chair, you now have visited a number of facilities, including the latest at Combe dispenser, and they have a challenge with water. So all this, Chair, I have told Governor in your unnecessary expenses, because rental supplies, medical cases, medical laboratory reagents, branding linen, which is understandable, fuel and oil transport, which is 2.6 million, fuel for production. I will need clarity, Governor, because that is why this clerical error came, by the way, because you are saying fuel and oil for transport 2.6 million. Then you say fuel for production 815,000. So, Chair, I have total unnecessary expenses comes to around 12.8 to 13 million. From general office expenses, catering, health celebrations, printing and stationery, computer accessories, telephone and communication expenses. And I found an interesting thing, Chair. Governor, do you outsource consultant services because you have paid 776,000? Who are these people? Does it mean you have professional? Does it mean Nandi County and your chief officer of health is here? Does it mean Nandi County lacks some of the professionals, and that is why you are outsourcing consultancy services, where you are paying in one financial year 776,000? So, Chair, you can look in unnecessary and unfortunate expenses. It comes to more than 13 million Kenya shillings, which comes to almost a half, or even almost a half of pharmaceutical supplies of 26 million. That is why the governor has argued that there is delay in there is not an availability of drugs, because he's spending it on unnecessary expenses. So my question, Governor, what is the justifiable reasoning or spending these 12 million in health celebrations, in general office expenses, in printing and stationery, in computer accessories, in airtime, in professional consultancy? And Makiu, I will assist by guiding you that when you talk about catering, there is already a provision of food and ratio, which I assume this is one is being supplied to the patients of 4.6. Even if you are to say doctors and nurses are consuming 3.4, they are almost consuming the same as the patients, yet the patients are much more. So that will be my third and final question, Chair. I yield the ground.
There are so many questions. I don't know whether, Governor, you are writing down all of them.
But I requested, Chair, if you had, I requested him to write it down.
Chair, yeah. I think, and maybe just need guidance, analyzing the details of a budget was not an audit query. If we needed those details, and the Senator wants those details, and the committee
Chair, on point of order, on Article 229(4), it says the Parliament shall consider.
Kindly allow me to talk. You have had your bite. into a forum come specifically to address ourselves to specific questions and specific issues. Details of analyzing the item by item of the budget, there is a whole process of how a budget is arrived at. It's not a decision of the governor. The budget is not done by the governor. It is done by various institutions, including public participation, including the county assembly, and therefore the details of those discussions of this one and this and this, if then the senator needs details on those ones and we are communicated in writing in good time, we can respond so that we can be able to give specific responses to each of those questions. But really, if you look at what we came, the audit queries, we are here to respond. If we allow that kind of questioning, then, you know, I might then require to have a whole team, but also in good time for us to discuss. So I think what the Senate has raised, valid as they are, if you can be able to share with us in writing, we can be able to respond to all those issues. But really, it would be fair that we are able to deal with audit queries as captured and, you know, on the basis of what I was invited to come and respond to, than really to go on, you know, on a mission that, you know, again, I am able to respond on top of my head on those issues. Yet, we have a whole team and a whole process and a procedure how budgets are done. You know, I may even find when a budget is done, you know, even if you have concerns as a governor that maybe this should have been, that is why it is, you know, we provide a budget that goes to the assembly, it goes through public participation, it is amended, certain things are changed based on the input of the public and the county assembly, and therefore when the budget finally is approved, it may not be exactly what the governor had provided for. So really, let's just be fair so that it doesn't look like this budget is drawn exclusively by the governor. And if we want to have a discussion on the budget and, you know, the entire budget line by line, I think a better forum, you know, should then be availed so that then we can have that discussion. So I think let's just be fair in terms of what needs to be responded.
I think what I think Senator Cherargei was doing was that the query on budget and performance, it showed there were variances between what was budgeted and what was actually spent. So what he was trying to analyze is actually the financial statements that and linking it to that query. That maybe the expenditure was varied from the budget because of the transaction that are listed here. So I think he was struggling to try and link that to the budget performance. But anyway, let me give him a chance to respond. And then
I think you have captured partly what I asked. I was just looking at the budget performance and control. And even I asked a basic question to the governor. Do we need hiring of consultant services? You should have said we don't have a gynecologist, for example, or oncologist, and say that's the reason we pay. It is a simple question. So, Governor, Chair, what can happen if the governor would want to respond on budget priority that are on his own financial statements, and then the committee can write a letter to him. But my other questions the governor has avoided is even a simple question, revenue collection from Kapsabet all the way to Kaiboi hospitals, are they automated? Governor, do we need a meeting? I thought it's a yes or no, and which company is doing the collection? I thought that was a very fair question. And another question was why you are missing your targets in terms of revenue collection. And then number three, Chair, because we are on budget performance and control, is on the issue of priority. My question, Governor, the reason I was giving an examples of your own audit, and I know your fund manager is there, is I was asking, do we need to spend in your own financial statements, which is not generated by the Senate or OAG, do we need a priority of 13.1 million as opposed to 26 million that we are using to buy drugs. And then finally, Chair, Governor, the committee can write and request for details on those line by line budget. So, Governor, you are arguing before this committee in Article 229, Parliament shall consider reports from OAG. Then, Governor, why should we have this meeting if you can write written submissions and you don't need to appear before this committee? Because if we cannot ask clarification in consideration process to process our audit reports that will be tabled, then why should we have a meeting? If you can answer the 4 questions on the budget line, the committee can write, then you can respond. But can you respond on the issue of collection of revenue, the target that you have missed, the issue of priority, and the issue of the automation? And I ask a very basic question. You and me know that, and Chair, it is on record, and it is on the audit report of 23-24, that you had most of your stalled projects are linked to hospitals. And I was asking, could it be the reason that you are conducting, because newborn mother and baby in Kapsabet is yet to be finished. Your own hospital, which is in Kobuja, is yet to be finished. Kapsengere is yet to be finished. Chepteruai is yet to be finished. And it is in the audit report, which is part of this consideration. And I was asking, could it be the reason why you are missing your revenue target and therefore affecting the budget performance, which is part of the audit query? So for the governor to say the issue of budget is not an audit query is misleading this committee, because one of the audits that are here is on the budget performance and control. So can he answer the questions, or if he doesn't want to answer, we can leave it at that.
Well, maybe I can give your point is well noted, Senator. Your point is well noted.
Chairman,
yes,
nobody has underplayed the importance of appearing before the Senate, but also we could come here and we have a whole discussion on literally everything under the sun. It is possible, but I think for effective utilization of the time before the committee, the order has been that then you come and respond to audit queries. And that is my simple thing. I'm not saying that what he's asking is not, but get a forum for us to discuss those ones so that we have those details. But then if you discuss,
just these are audit queries.
Why don't you listen?
This is on the audit report.
Yeah. Let him finish.
Unless the governor, sorry, Chair, unless I didn't get him right, I thought the governor has a benefit of the audit report. The questions I'm asking is emanating from the budget.
If the senator can spend more time listening, because he is speaking, and even when I am responding, he is speaking.
I'm active listener. And I think governor is taking this meeting casually, because the questions I'm raising, to be fair, even members here, is I'm asking valid question. Is our systems of collection of revenue hospital automated? Does it need a literary explanation, Chair?
Okay, let me direct this.
Yeah.
We have our fiscal analyst here. You are there.
Yes.
Yeah. I think the issue here is the query on budget control and performance. And the senator is trying to relate this to the financial statement. So we will ask you, because we need to make progress, to analyze what he has pointed out and then draw a parallel with that query of budget control and performance. Then the committee at report writing stage will make a decision on that matter. Because I'm saying we are going to spend a lot of time on this back and forth.
Chair, maybe with fiscal analysts, what is the revenue potential of Nandi?
Thank you, Senator. Through the chair, under CRA, based on the latest report they gave, that is a report on the year 2022, states that Nandi County, the revenue potential was around 4,353,000,000. That is based on that report. However, as a county specific, based on their target for the year under review, the target was 558,329,869, and they collected 307 million, which is appropriation is around 55% based on what their target and what they actually collected. Thank you, Chair.
That is the reason, Chair. That's why I was asking, because even when you look at the overall all source revenue, they are still missing the target, just the potential. And maybe, Chair, so that we close that question. So does it mean Governor will not answer my questions? So that I leave it, I know how to.
No, I think what the governor is implying,
Yes.
He had prepared to respond.
But Chair, let me ask you a simple. I have just asked, is our systems automated? Does it need to prepare? It is something basic.
Yes or no?
It's a yes or no. And then you consultant services, I have asked, do we have oncologists, for example? He can say, no, that is the reason we hire.
Chair.
So it's simple.
Okay, let us allow him.
Chair, we can write a whole letter, and then he can come and answer another day, if that will assist him to answer.
No. Let us allow the governor to take quality time to give an explanation, and then we move. Because
So, Chair, I will respond to the issues that touch on our appearance here. On the question of automation, yes, all our revenue collection collection processes are automated. 2, consultancy services. We provide radiology services in Kapsabet. We do not have, radiologists and certain other consultants that we have to pay consultancy services for them to provide those services. So we have those categories of specialists that we do not have, that we have to outsource their services. In terms of the various projects that are ongoing within the county, FIF is not financing, the various infrastructure projects that are ongoing. They are being supported or they are being funded by the county budget. FIF largely targets the resources that are being raised within the hospital from the services that we offer, and the same money goes to the services and goes to supporting the continuity of those services. So there are no infrastructure projects like the ones that you have mentioned that are being funded by this. Chair, in terms of prioritization and budget, rationale, I think that is a discussion that we are happy to engage if the details are given in terms of what the senator wants to know, and we can be able to respond to those ones.
I think, Chair, the governor did not get me very well with a lot of intelligence. But Chair, I didn't mean that. I'm aware FIF does not find infrastructure. I was saying this matters has been raised, and I was trying to tie up that would it be the reason you are missing revenue target by 41% in collection of revenue within the health facilities. I didn't mean that you are using FIF to fund, because we know the law. So that does it affect the performance of collection of revenue within the health facilities within Nandi?
No, it does not.
Just my simple question.
It does not.
Okay.